Oh, good morning, Mrs. Jones. How are you?
Oh, okay.
Oh, okay.
Yeah.
Yeah. Righty-ho. So,
just get rid of this.
yeah.
Thank you. Thanks very much.
So, how have you been keeping?
Well, okay.
Oh.
How am I?
Yeah.
Oh.
Yeah, you look a little bit peaky today, Mrs. Jones.
Yeah, no, I'm really not. You know, I've got this, like a really heavy feeling in my chest. And then it's like, you know, pins and needles going up and down my arm.
And whilst you're sitting there now, do you feel this pressure on your chest? Do you feel that
it's
pressure?
not pain, it's just, it's
pressing?
a pressure,
Okay.
yeah.
Cool.
Feels like people are really pushing down on my chest because I was just sitting and waiting. And
I think I'll get
felt
that oxygen in the bag.
It's a needles on
Okay,
my arm.
cool. And does this funny feeling go anywhere else at all? Does it go into your jaw, into your shoulders?
It's mostly just like a really heavy, somebody pressing down on my chest.
Okay.
If at any point the patient seems unwell, stop treatment, make the situation safe, get help, and locate your medical emergency equipment, including treatment algorithms.
I felt it more.
What I'm going to do, we're not going to start the dental treatment at the moment today because I'm a bit worried about what's going on here. So what we'll do is we'll just try and sort that pressure that you're feeling on there.
Yeah.
What I want to do is I want Purdy to give you some oxygen because you do look a bit pale and peaky. Now you've been sitting down for a while. Yeah. So I'm just going to try and sort that out for you. Purdy's going to give you a little bit of oxygen. And Purdy, if we can get Anthony in, that'll be a great help. And yeah, adjust that mask and makes it fit. And that's just oxygen.
Anthony, could you come in, please?
How's your breathing feeling?
Well,
Do you feel breathless at all?
Yeah.
Yeah, a little bit breathless. And how do you feel?
just not very well.
Not very well. Okay. Anthony, Mrs. Jones has got some chest pain here. So can you just dial 999, tell them that she's got some central chest pain radiating down into the left arm, and then we'd like someone to come and have a little chat with us. That'd be brilliant. Thank you, Anthony. I'm just going to put a little finger probe onto your finger.
Count the respiratory rate. Attach oxygen saturations if you have it. Consider the colour of the patient and look for normal chest movement.
Okay, so let's see what your sats are doing. Okay, your hands are quite cold, so that's not picking up. So we'll leave that there for a second. Okay, let's get some GTN and aspirin here.
Yes, that's the correct address. Yeah, that's the correct telephone number. Yeah, she's conscious. Yeah, she's breathing normally. Just a pain on the chest and on the left arm. Yeah, okay, I'm waiting for the car, thank you.
Just a couple of spray under your tongue, Mrs. Jones. So that's it, lift your tongue. And I just want you to chew on this tablet for me. Well done. Do you want to
Okay, if I were to pop this on, in fact, if you can, just see if Chris is out there, see if Chris is available to give us a hand.
Chris, can you come in, please?
Feel for pulses, assess capillary refill time, and check blood pressure if you have the equipment. Also feel the skin temperature.
Oh, hi, Chris. Can you start writing things down for me? And
It is important to document what happened as it happens if possible to ensure accuracy of times, drug doses and the condition of the patient.
the SATS monitor's not picking up. Her hands are very, very cold. Her pulse feels a little fast. It's going at least 150 and it's irregular.
Blood pressure 140 over 100.
Excellent. So that's the blood pressure. Capillary refill time's about 3 seconds.
In disability, assess level of consciousness by using the AVPU score. Check the patient's blood sugar levels, and if they're conscious, ask them to move their limbs to look for any signs of weakness.
Mrs. Jones? Mrs. Jones, can you hear me? Okay, yeah. Can you just get the bed down straight for me, Chris?
If at any point the condition of the patient changes, stop and go back and reassess airway.
Okay, let's get that oxygen off. Okay, I'm gonna look in her mouth. Okay, she's got some vomit here. Let's have some suction, please. Lovely. Okay. Okay, thank you. 1, 2, 3, 4, 5, 6. Okay, she's not breathing normally. Anthony, get in here! Chris, can you work the AED? Purdy, I want you to take charge of the airway. Okay, Anthony, can you redial 999?
As the patient is in cardiac arrest, to improve ventilation, size and insert an oropharyngeal airway.
Yeah, I call earlier. The Smart Studio, Degenham. Yes, she's non-cardiac arrest. Yes, they started CPR. We have a defibrillator. Yes, yeah, come quickly. Yeah, thank you.
Look carefully at the pictures on the white adhesive pad. Peel one pad from the yellow
15, 16, 17, 18, 19, 20, 21, 22, 23, 26, 27, 28, 29, 30. 2 breaths. 1, 2.
Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Press the flashing orange button. Shock delivered.
1, 2, 3, 4, 16, 17, 18, 19, 20, 21, 20. Chris, are you ready to take over?
Change staff regularly to ensure high quality chest compressions.
Over.
13, 14, 15, 16, 17, 18, 19, 20.
Oh, hi, paramedic. Yeah. Okay, we've got a 60-year-old lady who's in cardiac arrest. She's got a known high blood pressure. She came in for dental treatment and we started having chest pain. We gave her GTN, aspirin and oxygen, and then she collapsed. We've shocked her once and we've been doing CPR throughout. So over to you, what do you want us to do?
Okay, thanks. Can you guys carry on with CPR whilst I set up for intubation? Because somebody go meet the ambulance and tell them what's happening.
We'll do that. Anthony, if you go meet the ambulance and we'll carry over.
So in summary, if you think someone has chest pain, stop dental treatment and make the situation safe. Assess the patient using the structured airway, breathing, circulation, disability and exposure approach. Call for help and call the emergency services early. Give high flow oxygen with the correct oxygen mask and treat the conscious patient with 300 milligrams of aspirin and 2 sprays of GTN under the tongue. If you have a defibrillator, make sure it is nearby and prepare to do CPR if the patient collapses and is not breathing normally. Use algorithms to remind you of the treatment guidelines and prepare for handover to the paramedics. Document what happened as it happens and debrief your team after the event.